Hey, Christina. Sorry about that. My mic was muted. Good morning, good evening, wherever you may be, everybody. I am wanting to talk to you a little bit about the coronavirus tonight. We've got new numbers released by B&O News. So, new updates from B&O. China is actually releasing some honest figures tonight. We have 640 confirmed deaths, well, 39, and we have 31,000 infected. With the suspected, I don't know, what is it, 26,000 cases, that is suspected to be updated here in about 15 minutes with new numbers. So this could go up by as much as 3,000 confirmed cases, which has been doing every night, which would bring the total up to about 34,000 confirmed cases of the corona outbreak. So here we go. Here's B&O's official numbers. That's what we have right now. And in the U.S., we have one more confirmed case, but we've got one recovered. The person here in Washington State has successfully recovered and he's been released from the hospital. So that's some good news there. And in the U.S., from what I know, we only have one person in serious condition, and the rest of them are considered in favorable condition, which means they're almost 100% expected to survive. So the mortality rate is actually dropping. There's a lot more people that are recovering than there were before, which is some good news. So I think they're making progress on the treatment of the virus. But that's B&O's latest updated numbers. And like I said, we're going to probably be getting an update in about 15 minutes to a half an hour. I'm not sure if I'll be on the air then. I'm just kind of doing a quick stream tonight. Oh, there's a buzzing noise. That may just be background noise. The heater is on, so it could be a fan or something. Let me look at my audio levels real quick. Yeah, I don't really think that there's anything I can do about that. At least not at the moment. I will try to do some audio compression in my testing later tonight, but when I'm going live, I can't adjust my audio settings on the fly like that without ending the stream and then restarting it. So bear with me tonight. Maybe tomorrow night we can fix that. So one of the stories that I want to cover is right now there's two possible theories to how the coronavirus started. One of them is that this was actually engineered by some sort of a government organization, and the other one is that this came from animals and it transferred to humans. I'm going to cover a little bit in depth about it being possibly engineered, because there's a lot of research out there on that right now. And right now there is only one story about how it could have came from animals and transferred to humans, but there's a lot of information right now that's actually suggesting that this was engineered by a biochemistry company based in China. And what happened is one of the employees probably got contaminated with the coronavirus, went home and started to spread it that way. And that's like the biggest theory right now as to how this actually started. So it says, Lyons Walter is not alone in his assessment of the genetic engineering origins of the coronavirus. Dr. Dong, who holds a doctorate degree in infectious diseases from Beijing University. Based on recent published scientific papers, this new coronavirus has unprecedented virolytic features that suggest genetic engineering may have been involved at least in certain areas. The virus presents with several clinical features, thus it poses a huge threat to humans. It is imperative for scientists, physicians, and people all over the world, including governments and public health authorities, to make every effort to investigate this mysterious and suspicious virus in order to educate its origin and protect the ultimate future of the human race. So, this doctor literally thinks that this could infect up to 20% of the population of the entire planet. And if that happened, based on the current mortality rate, I'd say about 15% of those people would succumb to the virus itself. So 15% of 20%, you're talking maybe 4% of the world's population could actually die from this virus if it gets a hold of it and it gets a real good grab, and China can't really isolate this like they're trying to do. But as we've seen in the past, China's not very good at doing that. They tried to do that with the SARS virus, and they only did more harm than good because they kept the statistics and actual numbers from the public, kind of like they're doing now. So a little farther down, it goes on to quote another study. Uh, January 5th, 2020, study by Greek scientists analyzed the genetics relationship of the 2019 nCoV and found that the new coronavirus provides a new league for most half of its genome, with no case of genetic relationships to others within the subspecies. So basically, what they're saying is they cannot find a link on how this evolved from other coronaviruses. So if we go back, and there's another article here about how scientists think the coronavirus actually came from animals and migrated its way to humans. And basically, that's from the Wall Street Journal, so I actually cannot read that article on the air. But kind of a breakdown summary is what they're saying is they think it came from bats because they think that's where the SARS virus came from in 2004. Basically, what their theory is they're saying that somebody got bit by a bat and then carried it into mainland China, and from there it started infecting most of its patients. And I don't know. There's not a lot of real good documented evidence to support that theory right now. Most of the signs are showing that this was a bioengineered virus because they cannot trace the direct link on how it skipped from animals to humans. And they were able to do that pretty quickly with the SARS virus, so there's definitely a lot of differences there. And today, the World Health Organization has officially classified this as a pandemic. It's no longer officially classified as an epidemic, although it's actually been a pandemic for weeks now. They're actually just getting around to classifying it as that. And there's a good article here on what classifies as a pandemic outbreak versus an epidemic outbreak. And I'll kind of go over the highlights of it here. It says the coronavirus outbreak that originated in China is serious enough to qualify as a world health emergency, but is it a pandemic? Excellent question. Let's review epidemic basics to find out. The basics, thinking back to the basics of the town you grew up in. Hang on a second. I have a very noisy dog here in the background, and I will try to quiet him down. I'm sorry about that. Alright, so think back to the town where you grew up in, and the infection that made its rounds as an epidemic level disease, or a community baseline preventing of it. It isn't always zero. Consider the chickenpox in the United States. The epidemic disease currently isn't curable, but it's expected. It basically summarizes how an epidemic is something that's kind of localized. It's in one geographical area, one town, one county, or even one country. And for something to be classified as a pandemic, it has to infect a substantial part outside of where it originated from, which the coronavirus is starting to do. So, um, ever since that there's been documented cases outside of China, it's technically actually been a pandemic and no longer been an epidemic. Epidemics are something that's much more concentrated to just one area, whether it be a city, a county, a state, or a country. And the cruise liner, it's called the Diamond Princess Cruise Liner, and it's got a total passenger count of 3,700 passengers, and they have had a corona outbreak on that cruise ship, and they have completely quarantined it and isolated the passengers. And so far, they've tested 273 of the 3,700 passengers, and 61 have tested positive. So they put the whole ship on mandatory quarantine for 3 weeks. So all passengers are currently stranded out at sea on the cruise liner. And it's interesting too because they're actually having problems right now where they're running out of supplies, they're running out of food, they're running out of diapers for infants, and it's not a very pleasant situation. There's one of them that's actually a YouTuber, and he did a stream about 5 or 6 hours ago, and he was talking about how they didn't get breakfast today until 2 p.m. So that's 2 in the afternoon. And when they finally did get breakfast, it consisted of like a couple of pieces of stale bread and one hard-boiled egg. So things definitely are not pretty there right now. And there's 37 Americans on that cruise liner. But it hasn't went into depth as to whether or not any of the Americans have tested positive or negative for the coronavirus. So we don't know about that yet. But the ship is docked right now, right off of the coast of Japan. So I think it's going to be coming back to the US as soon as the quarantine's over. But I'm not sure. Let me see if I can find out. Mandatory quarantine of 3 weeks. Oh, originally departed from Canada. Yeah, at least 20 people on board tested positive for coronavirus, 3 from the U.S. So yes, 3 U.S. passengers have tested positive for the coronavirus. Well, I think that's all I have for updates right now. I will definitely be covering this more tomorrow. But until then, I think I'm going to conclude this stream. Thanks for watching. Bye.